TB notification and management. I am Dr. Lourdes A, a moderator for this panel discussion together with Dr. Janice Caoili. The objectives of this panel discussion is for us to understand the 4 different perspectives pertaining to the mandatory TB notification aspect of the TB law in the Philippines, to include inputs from the National TB Program, private-public mix, a private practitioner, and a community representative. Another objective is for us also to be oriented with the manner of TB notification of cases, especially in the private sector, the route and possible means of reporting. So, I now call on our panelists. Please proceed to the stage as I call your name. So, Dr. Ana Marie Celine G. Garfin was already introduced earlier. Okay. Maria Eloisa Teng, a community representative, is the founder of the National Coalition of Key Advocates Fighting TB in the Philippines and is a current member of WHO Regional Green Light Committee. Dr. Lalaine Mortera, a private-public mix advisor, is currently the Deputy Head, TB Assembly of the Asia-Pacific Society of Respirology, Co-Chair, PCCP TB Council, Technical Advisor for Private Sector USAID-funded TB Innovations and Health Systems Strengthening Project. And our last panelist is Dr. Joven V. Gonong, a pulmonary specialist, currently the head of a bronchoscopy section and a member of the TB Diagnostic Committee of the Lung Center of the Philippines. Dr. Janice Caoili, another moderator, will also present to us the Integrated TB Information System, online registration and TB notification. She is currently the head of Section of Infectious Diseases at the Makati Medical Center, a member of the board, PISMID and PhilCat. So the flow of this panel discussion will start with the presentation of the new TB law with focus on the notification aspect, then followed by a case presentation, a panel discussion, and finally the presentation of the Integrated TB Information System, online registration, and TB notification. So Dr. Garfin will now present the new TB law with focus on the TB notification aspect.
So good afternoon everyone. I'll be presenting regarding the TB law, that is RA 10767 and the mandatory TB notification. So first, now we have the high TB burden. I'm sure everybody knows this already. And what is important here, that we are missing 263,000 TB cases because we are only reporting 317,000 out of the 581 TB cases. And we are 4th in the world in terms of contribution of the number of TB cases. And based on the 2016 prevalence survey, the TB burden remains high and there are about 1 million Filipinos with tuberculosis. If we compare ourselves among the ASEAN countries, we have the worst incidence rate, that is 554 per 100,000 population. So this is globally, Philippines 6%, that is next to India, Indonesia, and China. Very big countries. Then in terms of cases, so I mentioned that we are missing TB cases. The red line shows the estimated number of TB cases, and then the blue line shows the number of cases that we report. So that would be about 251,000 TB cases not reported in 2018 alone. Okay, if we look at the prevalence survey, so 1/3 or 25% of our TB cases seeks consultation with the private sector. So the private sector is a very important sector that we have to collaborate with for us to address the burden of tuberculosis. So during the high-level body UN high-level meeting last year in 2018, Secretary Duque said that it would be business, not as usual, for us to address tuberculosis. and we committed to find 2.5 million TB cases. That is from 2017 to 2022. And for us to do that, we need to have a high-level TB body. That is because TB is not just a action that should be done by the health sector, but by other sectors also. So it's beyond health. Then we have to reach the targets, and we will be doing active case finding. So we'll have massive chest x-ray, that is the screening tool, and then we link that to expert. The most important part here is the mandatory notification. So we said we'll do mandatory notification, and our legal framework for this is Republic Act 10767. So this is the Comprehensive TB Elimination Plan Act. And it's stated as the policy is that we need to have an integrated and comprehensive approach to health development, and there should be increased investments for its prevention, treatment, and control. So it's not just treatment and control, but includes prevention already, and we should adopt a multi-sectoral approach. So one of the section here would state that we need to do mandatory notification. And when we say mandatory notification, it is a process of requiring all healthcare providers as well as facilities, both public, usually these are from the hospitals, and then the private, to report to the DOH every detected TB case using the format and processes that has been designed for this purpose. So the law RA 10767, Section 12, regarding notification of TB cases, states that all public and private health centers, hospitals, and facilities shall observe the National Protocol on TB Management and shall notify the DOH of all TB cases based on the Manual of Procedure. So for the IRR, this is what we stated, that current TB notification system shall be revised to cover all service providers. And it will not only those that are considered part of an established TB service delivery network. So it would include not only the facilities within the DOH, but all, to ensure that all cases diagnosed and treated are reported, including its outcome. So it's not just reporting the case, but we should ensure that it should include also the outcome. And then all public and private providers shall be guided accordingly by the NTP, MOP, and the current clinical practice guidelines. And what is good here, we said that we will review and consult all stakeholders. So it's not just for you to follow, but you can also provide feedback to us if the system that you're using is friendly or not. Okay. So why do we need to notify? Because TB is a notifiable disease and it is a major public health problem. And we need the data because we need to have a better picture of the burden of the disease. And the information that we will gather will help us design the strategies that we need to do to address the problem. So at the same time, this would also help us find the missing people with tuberculosis. So who are required? All healthcare providers delivering healthcare services from both the public and private facilities. And it includes those that are diagnosing only TB, those that are providing treatment and prevention. So unlike before, we only have reporting if you treat the case, if you start the treatment. But for this, even if you just diagnose, you need to report the case. Okay. So what are the steps? So we need to have registration of healthcare providers and facilities. So we do mapping, identification of a TB case, then we notify, then there will be data analysis and interpretation and provision of feedback and response. And we will consider the Data Privacy Act of 2012. And based on that, and based on our discussion with the Data Privacy Agency, the DOH can mandate the reporting of cases, but we should ensure that there should be privacy, and we use the data only for the designing of our strategies, and it's not for sharing. Okay. So all detected cases, so those that have been initiated treatment or not, refer to another provider for treatment and refuse treatment. So you might say there might be duplication. We just want you to report and we will do the deduplication. So that would not be a problem. Just report and then we will check the duplications. Okay, when should the cases be reported or notified? Upon diagnosis, upon initiation of treatment, and when the treatment outcome is known. So reporting is done at the end of each month, and you should also report if you don't have a case. So that is all. Thank you.
So I will now present a case to be discussed for TB notification. So a 47-year-old businesswoman consults a pulmonologist in a tertiary hospital in Makati for a 1-month cough with no relief from a course of an antibiotic. Chest x-ray was normal. Apparently, she was exposed to her driver who has been coughing and is now being treated in a health center. Expert done on this patient was positive for MTB, rifampicin susceptible. So now for our panelists, how would you go about the notification process? What are the perspectives of the different factors involved in this case? We will now hear perspectives from the National TB Program, the program's expectations regarding notification by Dr. Garfin, perspectives from the Private-Public Mix Project, the mechanism for reporting by Dr. Mortera, perspectives from a private physician, the challenges in reporting by Dr. Gonong, and perspectives from a community representative, the expectation from patients regarding protection of confidentiality by Ms. Eloisa Teng. Dr. Caoili will now head this discussion, and then she will also present the TB information system, integrated TB information system, online registration, and TB notification. Dr. Caoili.
Thank you. We have 3 minutes per panel member to discuss their perspectives regarding TB notification. We'll start with Dr. Garfin.
So for the program, we expect that the physician, if it is diagnosed within the facility of the physician or the laboratory, to report this case, since it is mentioned here that the expert was done on the patient. So I'm not sure if this pulmonologist in a tertiary hospital in Makati, they have the expert or they refer this to another facility. So we would expect the facility where the expert was done to report the case. So the laboratory will report, and if ever that laboratory did not report, and if the physician started the treatment, and the patient reported back to the patient, would also want the physician to report. Okay. So as I have mentioned earlier, if there would be, we will just do the deduplication. We just want everybody to report at the time of diagnosis and when they start reporting.
Thank you, Dr. Garfin. And the usual question is, how can we report? Now we are being required to report, then how can we report this to the Department of Health? Because as we all know, and it was presented by Dr. Mamel earlier, 75% or almost 77% of private physicians are willing to help the Department of Health regarding TB control. And I think reporting will be one of the activities that will be requested from us as private practitioners. So I will be requesting Dr. Lalaine Mortera to discuss the procedures for reporting and notification.
Yeah, thank you, Janice, for that question. Actually, before a doctor will be able to notify, the doctor should register first. And for registration, the system has offered 2 options. Doctors who would prefer the paper-based, those are not techie, so they can just fill out TB provider registration form. And this can be forwarded to the National TB Program by email, by slow mail. The second option is do it online. So there's the online registration. Now, once registered, the doctor can notify the case in 4 scenarios. First scenario, the doctor can directly notify the case Either again paper-based, that's already being done, also web-based. So later, for those who would like to notify and be registered, there's a booth that we have now at the Hall 1 where we can help you register and start the act of notifying. So in this case, either you are going to notify, I mean, if you will notify using the paper-based or the web-based. Soon we'll have an app, a notification app, but it's still being piloted. It is for both the Android version and the iOS. Okay, so that's the first option, the doctor to notify directly using these different tools. However, in this case, we have a pulmonologist affiliated in a tertiary hospital, which is Makati Med. So we will first ask if Makati Medical Center already have identified a hospital point person to do the notification in behalf of all their doctors. So usually it rests on the shoulders of the infection control nurse, often than not, or the infection control, this IDS specialist, or whoever the team or the committee that has been identified by the hospital. So in these hospital-based doctors, they create a system. Actually, there are some technical assistance already provided to tertiary hospitals in installing this hospital-wide notification system, where doctors are assisted to notify, and then their notification forms are collected in-house and then forwarded to the National Notification Officer. Now, a third option is there are some TB notification officers that are actually deployed to the hospitals. So if Makati Med happens to be one of the sites of this deployed personnel, then this doctor pulmonologist can notify the patient through this TB notification that are deployed in the hospital. And of course, the fourth one is if Makati Medical Center is a DOTS providing hospital, and there is of course an in-house TB DOTS clinic nurse, then it can be the TB DOTS clinic nurse that will be collecting these notification forms from all the doctors in the hospital. So this pulmonologist can just forward the notification form to the DOTS nurse. So those are the mechanisms to be able to notify.
Okay, thank you, Lalaine. And so we have 4 options. So before we didn't have the option of online reporting. We were not also requested to report on using paper forms. Before we had to have a DOTS clinic, but now we have 4 options. Right? So may I now ask Dr. Gonong, what are the usual concerns of doctors regarding notification of TB cases?
Thank you, Janice. There are challenges in reporting, and these are actual experiences coming from our colleagues. Like one, she registered during the APRC at the TB Innovations booth, and it took a while for her to receive her notification. So maybe our corrective action here is to have a same-day notification or within a week notification. But of course, we're improving our system as time goes by. Another one is a physician from Ormo. He was able to log in but cannot find the tabs on the top or the side for case management reporting. He tried to change his password, and after several attempts, his password was invalidated, and it takes 20 minutes for it to re-enter the system. But luckily, he was able to try or open it to in his Android, but I don't know if he succeeded in entering his case. I also have a personal experience. I tried to put in or press the forgot password, and mind you, I got an email. And the password was 32 characters, so it's just so. I diligently tried to follow it, and then I didn't succeed. And I guess seven characters should just be she should be sufficient rather than like 32 characters. So that just happened early this morning when I tried that. There are two other challenges. Another Pulmo, every time she encodes a new patient in ITs, the previous data is no longer available. So another one, some experience a hard time encoding in ITs, and so they opted paper-based reporting. It's not a problem if there's a notification officer who would come and collect your forms weekly, but maybe this could be a challenge in some clinics or hospitals whereby you're the only sole reporter or very few cases. So, and it's more practical to rely on the ITS. But I think it was mentioned earlier by my colleague here, Dr. Mortera, that the ITS is upgraded to version 2, and hopefully we get a better system.
Okay. So thank you, Dr. Gonong. It seems like it's more positive than negative. So we're trying. So we are true to that, to our efforts to really help the TB control program. So for some who cannot really, work with the web-based notification system, we still have the paper forms. How do we get the paper forms if we don't have a dance clinic? Where can we download the paper forms? And how can we forward the forms to ITs? Because, these are for clinics without the TB clinic in the hospital. Yeah, who can answer that?
Yeah, but before I answer that, just raise your hands. Who tried registering themselves in the notification app? Konti lang.
The ID fellows, 100%. Yes.
Okay, so these forms are actually available at the nearby health centers or the city health office or the provincial health office.
Oh, is it downloadable?
And then it can also be downloaded. In fact, if you would, it's downloadable, and then you can reprint for the hospital use. But for the individual doctors, they actually are provided with the forms already, and these are distributed to the different clinics. But again, if you have the online version, it will be earth-friendly, more earth-friendly.
Okay. So there, we'll now ask Louis. Louis will be our committee representative. And the usual concern of patients is, of course, confidentiality. You will be reporting my case. Will my employer know about it? Will I be removed from my work? Those concerns. So what are the other concerns that you think should be addressed when we fully implement the TB notification program?
Okay, I want to start introducing myself first. I'm Louis Zapeda-Teng, and I'm a tuberculosis meningitis survivor back in 2007, and I was transferred to Dr. Topasi right timing before I was placed in the terminal case. So I lost my eyes already, but when she observed me, I was able to be enrolled in the MTR program. So right timing. So this is actually an issue of confidentiality. Currently, I am now the TB People Organization Regional Focal Person for Asia Pacific. This was the creation or the end result of the Nairobi strategy last year for the workshop on human rights. And I represent the persons with disability, of course. I've been blind for 12 years. And we have created the Declaration for the Rights of Persons Affected with Tuberculosis. So we are currently drafting the 23 articles, and it's globally represented, and I'm representing our region. It will be launched in May 13 in Switzerland. And we have the article there on right to confidentiality, Article 10. And of course, there's a violation for electronically transferring information about the patient's records. And I'm checking out, I'm thinking about this situation. How did the doctor know that it's from the driver coughing for how many months? So it means
From history.
It's from somebody divulging the information.
No, it means that they asked the businesswoman.
The businesswoman
if
has the right.
he had,
Yes.
if she had any exposure.
Yes.
And she mentioned that her driver had TB.
She should have been
was
prompted.
recently diagnosed.
She should have been prompted to please don't share information about your suspected possible contact. So there's supposed to be a prompt from the physician that please disclose this information from the procedure that will be done to you from the procedures that the health provider is doing. But in terms of the right to confidentiality, both of them should be given that right. The driver and the patient. Because for us, it's of course a violation of their information. There's also the possibility that you will be discriminated, stigmatized, and you can actually experience verbal vilification because of your history of TB or your actively treating the disease. So for us, we really want to make sure that we protect each other. If ever we can ask the physicians, please prompt your patients to not name drop, not give these kinds of information right away to you, because we are going to be respecting the rights of the rest of the patients. And remember that this declaration of the rights of persons affected with tuberculosis is going to be signified, ratified into our countries. And of course, like the TB law 10767, of course we want it to be very holistic, and hopefully all of the articles for us to right to education, right to work. DOLE has a law for that. Don't ask history of tuberculosis, but still our private entities are still violating that law, because if you have a scratch in your lung, they won't employ you anymore. I'm a person who has been unemployed for 12 years. That's why I do international consultancies instead, because our country does not follow that law. So I hope you all help us out.
Thank you, Louis. So I have two questions for the panel. One is for Dr. Celine. Can you please answer the question of Louis regarding ensuring that privacy is observed when doctors report to the National TB Program? And the second question will be for Dr. Gonong regarding, when we have when we, of course, consult, when the patients consult with us, and then we ask about, history of exposure, how can we maintain confidentiality, and that we just, ensure that that information shared to us will stay within the clinic and between the doctor and the patient? For Dr. C.
So I know it's a common concern. Now when we report, will they really not share this data? But what I can assure you is we have been trained, and we also have an assessment of all the forms of the program if we are following the statements or the policies of the Data Privacy Act. So we have been trained, and at the same time, we have a monitoring. And I know everybody now is really aware of the Data Privacy Act, so we are always reminded. So even if there are researchers that would be asking for data, we would provide the data, but it is anonymized. But if you study the Data Privacy Act, it would not just be removing the names. Because the Data Privacy Act would say that the data that you provide would not allow the person to trace who that person is. So sometimes it would include the address. So we are aware of those what data we can share. And because we did an assessment with the we have a privacy. There was an assessment done with the program, and they informed us what data we can share with those that are requesting data.
So what we understand from this, our discussion is that whatever information that is shared to the National TB Program, it will only be used by the NTP what can be shared by NTP will not include patient identifiers. So it should protect the identity of our patients. And the employer should not know, right, that these patients were notified to the NTP. There is no communication between the NTP and the employers of these patients. Okay.
Because we even do not go. But at the same time, we are also working with the Department of Labor and Employment for them to follow these guidelines, especially the provision that the patients should not be taken from their job if they cannot be removed from their job if they have tuberculosis. Because we are also receiving calls from workers. They said that they have TB, that they have you should go to your clinic, but they are apprehensive or they will be removed. So we are calling the attention of the.
Thank you. Now for the confidential concern about information shared to doctors by our patients.
Well, I understand the concern of Louis, but as physicians, we really train, and because one of our concerns at Louis is, and we're trained to ask for the medical history. It's needed for us to treat our patient very well also. Maybe in the case you can see, it says the age, the work. We did not identify the driver, not even the hospital where they went. We have a patient-physician relationship, and we really should be bound to hold them to respect the confidentiality. But since the medical history is really part of our interview, we need to get our facts right. Like for example, if our case is the source or the index was like the driver, for example, had a history of multi-drug resistant or XDRP, then it could really help us assess better, treat our case properly. So we assure you that we will, as physicians, we should be bound to respect the confidentiality of our cases as part of our physician-patient relationship.
We also discussed in our previous sessions that when we start reporting TB cases, we will also inform our patients. I think that was really understanding by all physicians participating in this program. Okay, Louis, you have the last message, Louis, because I will be now presenting, hopefully we have time, the how to do online registration and online notification.
Well, as long as our rights are respected, and to help us also tell that they have rights now, because we have TB law now, we have that is the international declaration. I hope that you can also inform them that we have a group now, we have peer groups proud to be legalized one of these days, but we are being created slowly but surely, because most of them, they feel that they're alone. I thought I was alone. I had a lot of depression back then. So who can they go to? They can go to you every day. They don't have that money. But they can do definitely, you can definitely refer them to our groups. We're trying to be established. Thank you.
Okay, thank you, Lily, for that. Okay, do we have, I'm sorry. Okay, we can entertain them. Okay, Lalaine.
In response to Louis' comment, there's such a thing as a patient TB charter, where the rights and the responsibilities are enlisted. So I would recommend that in all our health facilities, we have copies of that at our clinics or in any open area where patients are waiting. Because notification is actually the free flow of information from the healthcare provider to the notification authorities. But beyond those, like the employers, the neighbors, they're outside the notification system. So they should not be party, or they should not be they should not have the information from the doctor. For those information that will be shared, patient's consent will already be needed. But within the context of notification and surveillance, it should supposed to be a free flow of information.
Thank you, Lalaine. So we can entertain maybe 2 questions. Okay, yes, Arlene.
So when the patient asks us for a medical certificate for clearance to work, that is not saying that we are not violating their rights. And also, for example, they ask us to fill up their SSS reimbursement. So we have to write down the correct diagnosis also. So is that also violating the privacy?
Okay.
Because we also have to think about that the patient cannot be cleared for work yet for at least 2 weeks. So we have to justify why we cannot allow them to go back to work for 2 weeks. So is that violating the privacy?
Thank you, Arlene. So who among our members would like to answer? Okay.
Okay, violating means you did not ask their, what do you call this, consent. But if they're the ones asking you to give them that evidence that they are clear, or if they're stubborn, they want you to clear them even if they're not yet finished, then it's up to you to decide if it's proper for them to have that kind of certification. But if it's according to their request, they want you to clear their name so that they can apply, it's not a violation at all. It's you got their consent to create that document.
Okay, thank you, Louis. Other comments? Celine.
That's why we're also coordinating. That's why we're also coordinating with the DOLE, because we want them to disseminate their information that the worker that has tuberculosis should not be removed from their job. I think that's one of the important things that we should disseminate, one information that we should disseminate.
Thank you. So, one more question?
Yeah, Janice, if I could just ask. We have a different way of providing our medical clearance in lung center. We don't actually write the diagnosis. We just write fit for employment or travel or study. But of course, there are patients who come to us. It's because it's a requirement of the employer or the other agencies. That's when they expand and write in a letter, that they have a history of treatment, and this is the drugs that these are the drugs that they need to. But that's usually a request from the patient.
So how about for SSS? And there's a portion there for diagnosis.
Well,
Do you put pulmonary tuberculosis?
Yeah. And then, but it becomes an advantage because
It is.
we presume that will stay in the HR. It's not something that.
It's for SSS.
Yes.
Yes. Okay. Exactly. Yeah. HR doesn't require the diagnosis, so they just want to know if the staff, if their employees fit to work. Yes.
Okay. I have 2 questions. Number 1 is mandatory reporting or notification will not require us doctors informing the patient that we will report them to the ETIS. And actually, I've not tried doing the online reporting, but I heard from colleagues that the reporting basically asks for a lot of questions, including the patient's complete address. Kung wala daw yung barangay, hindi na daw tatanggapin. So basically, it's a complete information of the patient. Sa HIV kasi, when we talk to these patients, we tell them that part of the testing, you will be part of the database, di ba? We inform them. Pero with TB, is there a need to ask permission or inform the patient that we will be notifying, we will be sending their data for notification?
Lalaine will answer.
Actually, we have to inform the patient that we will notify them. So we will not get the consent, we will not ask the patient if they're willing to be notified or not. That defeats the purpose of mandatory notification. So if I were the doctor, I will tell the patient, I am required by law to notify that you have TB. But rest assured, I will be giving this information only to notification officers and nothing more. So the patient will be assured that the patient's details will not be shared with anyone but only to authorized persons. So they have to be informed about that. Actually, that's one of the rights of a patient, to be known, to be informed that they will be notified. So like HIV or other notifiable diseases.
Because in HIV kasi, Doktora, they are made to sign an informed consent, and then it is part of the informed consent na their data will be sent. So, ang sa akin lang kasi, if we don't let this patient sign a consent that indeed they allow us to send their data, and then later on they will have a whatever reason from their end to sue us for sending such information. There's nothing we can defend ourselves with. Sa HIV kasi merong informed consent.
So sa HIV, maybe I can answer that portion. They already removed the portion for the consent. So now the new form that is being used by the no more, because it's also mandatory, it will be reported to the Department of Health. So the portion on the consent, the portion of the consent is now separate. And the hospitals now, if they want to have it, it will be a separate one-half form. Kaya dumami ang forms natin. Kasi sininiwalay nila yung consent.
Bali choice na yan sa hospital if they have.
It has been our practice that they sign that. So it looks like, hindi na natin pinalitan yan. But if you look at the new HIV form, it doesn't require the signature of the patient.
Okay. Ang sa akin is we don't see any problems with the TB notification without asking informed consent or any consent of the patient with all the data we're going to submit online or to the agency, to the office.
Sige. So I think that was probably answered earlier, but maybe not very clear yet regarding information to be sent to the NTB. Who would like to answer that?
Well, maybe I just would like to tell the Dr. that TB is a public health issue, and for me it's very important that you get the address also, because there could be clustering in certain locality, especially if you're dealing with drug-resistant TB or new cases, which can be targeted by the program managers. So there's an advantage in reporting.
The address, for example. So the address will be used to filter, like reports, and also it will be used for tracing the patients. So hopefully, that's how you will use the information. Because if we have time, I can show you the form. Maybe I can just show you the form. No more now. The many items that will be required from us. But it will, okay, this is already the process. Okay, so are there other questions while we're loading the slides? Doctor, did you have a question? Okay, so we are now helping the Department of Health and the FHI 360 implement the mandatory TB notification. So BISMID now has a TB roadshow, and hopefully it will be shown in your center soon. So what we are trying to do is to ask every healthcare worker seeing patients to register. Okay, so these are the URL that you need to log on to. There's an official one and an alternative. It doesn't matter, but really, it's the alternative that works better. You may PBSP. So we were told that even if it is a PBSP there, PBSP is helping the Department of Health with this project. So here, when you log in there, you will be shown this form, no? You will be asked this information as a doctor. There. Yan ang kailangan. 15 information from you. Okay? And those with asterisks are required. So not very hard. It will take maybe 2 minutes. And then you will be able to register. Yun nga lang, sometimes, it will take a while for you to get this email from ITs or from DOH. Nagkakaproblema sila minsan sa email address. If you have the underscore or if you have, certain if the email is not very clear, sometimes they are not able to send you back the confirmation that you registered. But if you get this email from them, they will provide you with a username and a password. So this is what you will use to notify. Okay? So when you notify, you have another URL. Okay? There's also an official and an alternate. And the alternate also works better. And then when you click on that URL, you will see this one. Okay? We will provide you with this. I don't know how, but we can provide you with these slides. And then you will be asked to log in the username and the password that was provided to you by the ITs. And there, you can start notifying your cases. Okay? So you click on TB notification, and then you will be asked to fill out the form. Yan. Patient's last name, patient's first name, patient's middle name, date diagnosed, the birth date, the age, the sex of the patient, the address, and the address has to be a complete address, the contact number of the patient, the bacteriologic status, and if the patient was referred to another facility or you are treating the patient. So that's the only information that will be asked from us. And some doctors find it very difficult to fill out all the information, so they identify a person in the hospital to actually do this for them. Because you don't really need a doctor to fill out this form, right? You can ask your secretary or someone in the hospital to get this information from your chart and then report it to the NTP. Okay, now you have it. Okay, and then every time you can actually update. No? You can update the status of your patient, and then the treatment outcome can be updated, whether the patient was cured, completed treatment, lost to follow-up, failed diet, or not evaluated. Okay? And then every time you log in, you will see the number of patients that you have notified. Okay, the cases also. And you can also update the cases that you notified. So now that you see the information that are needed, do you have additional questions for our panel? Louis, do you have any questions about that? The information that's being required from patients? Or not really required from patients, required from the institutions to report the NTP.
Of course, I'm also representing the marginalized sector of the disability, right? And I work with the use of talking cell phone. So, as much as possible, hopefully the websites are also blind friendly. And if ever there are those with disabilities as well, maybe you could assist them in the filling up of the forms.
So this will be filled with the doctors.
Yes. Also, if ever there are going to be future materials for us, for us patients, of course, take note of the 20% persons with disability in the country.
Thank you.
Yeah, I would just like again to advertise the booth that would help doctors to register as a private physician notifier. It is located at Hall 1. It is near the registration area. So just look for the TB Innovations project booth, and they will happily assist you in registering.
For the program, I would just like to inform that as of now, it's not a perfect system. So we need your feedback so that we can improve. So just email us and you can provide that information.
Yes, we can. So when you get the email from ITs, they actually give you their email address, their cell phone, so you can get in touch with them. Andrew is in charge of the whole thing, and then he actually answers text messages. So he's very helpful. Okay, so that ends our panel session, the first panel session this afternoon. We would like to thank our speakers, of course, Lalaine, Gonong, Celine, and Caoili, for this session. Thank you.